Hello, good evening, everyone. Today I'm going to speak on the danger signs during pregnancy. So, when you are pregnant, you are planning to get pregnant, you are not supposed to see these danger signs. So, when you see these danger signs, please consult a doctor or visit the healthcare center before things get into worse or for other interventions. So number one danger sign during pregnancy is vaginal bleeding. So if you are pregnancy, if you see bleeding through the vagina, so you start worrying and you run immediately to the doctor so that early intervention can be taken. Maybe it could be some abortion that has been taken place. There are types of abortion. You could not know which type of abortion has occurred. Maybe it could be threatened abortion that it could be maybe threatened abortion, maybe it could be sepsis, maybe it could be missed or any kind of abortion. So another danger signs during pregnancy is just abdominal pain. When you experience severe abdominal pains, it means that there is a problem somewhere into the system of the body. So early intervention can be done immediately. Another danger signs during pregnancy is headache. If you are pregnant and you experience severe headaches, just visit the health center or just visit the hospital for more intervention. It can be means maybe that you have some medical condition like preeclampsia that increases the blood pressure in your system, hence causing the heart to overwork. Hence, by doing this, can cause maybe it can end up doing can end up making bad outcomes during pregnancy. So, if you experience severe headache, just visit the healthcare center for more intervention. Another danger signs during pregnancy is reduced fetal movement. Maybe today you say that my child has played or has rotated or has kicking for almost 10 times. Tomorrow, when reaches tomorrow, the 10 has been reduced maybe into 5 or into 2. So immediately you notice that, run to the health center or the hospital for more intervention. It could be means that there is some stressful activity inside your fetus and that makes him to experience that reduced fetal movement. Another danger signs during pregnancy is discharge through the vagina. Okay, if you experience some discharges through the vagina, it means that you have maybe some diseases. Maybe could be UTI or maybe could be other STI diseases. You maybe could be some other conditions. So immediately you experience these danger signs during pregnancy, you need or you immediately supposed to visit the healthcare center. Another signs or danger signs during pregnancy is just experiencing some tiredness. So, if you are pregnancy, you are supposed to be having bed rest and just doing some small exercises. So, avoid those extraneous activity that can cause you maybe of you having some problems during pregnancy. Another danger signs during pregnancy you are not supposed to see when you are being pregnant is blood vision. So if you are pregnancy and you are experiencing some blood vision, you need to consult a medical officer for earlier intervention. So there are some conditions that you may supposedly to be having so that early intervention can be done. Sometimes it could be maybe the high blood pressure disorders like preeclampsia, eclampsia, diabetic mellitus, yeah, hypertensive disorders. So if you see one or two or all of these, you need to visit the health center for earlier interventions. So, if you are pregnancy and you want a healthful baby and you yourself to be healthy during pregnancy and after labor, you are supposed to care for the pregnancy. What are some of the care that you are supposed to do during pregnancy? First care during pregnancy is eating well. At least you increase the number of meals that you eat per day. If you eat thrice per day, make sure that you increase the number to be four at least per day. Another care during pregnancy is just antenatal care. This is that care given to women. It is called focused antenatal care. So you are supposed to visit the MCH, maternal and child health, so that monitoring of the fetal well-being should be done at the right time and at the right trimester. Another care during pregnancy is just drinking a lot of water. You are supposed that at least per day you should drink 2 liters of water, all 8 glasses of water, so that you can so that so because water is just health for human being and for your baby. Another thing is just sleeping under the net. If you are pregnancy and you are not sleeping under the net, you are at risk of getting malaria in pregnancy. So you must sleep in a net, and a net that has been treated soon. So another care during pregnancy is just taking the IFAs. IFAs are just the iron drug that you are given during antenatal visits. You are being that you are supposed to take during the month before going to the next visit, so that they can increase the